Welcome back to DXB. Today it's All World Government Summit and the future of healthcare, and where would we be without our healthcare facilities? And that's why we are very excited to have our next guest with us. He's in charge of expansion at American Hospital Dubai. Please join me in welcoming Amer Omar Salha to the show. Thank you so much for being with us.
Thank you.
What are the immediate steps that American Hospital Dubai is taking when it comes to emerging healthcare?
We have always progressively had a thought process and a focus. Our strategy is to always assess the patient journey and try to improve the clinical outcome. Start with better diagnosis, more accurate diagnosis, and then assess and talk to our care providers and physicians in terms of what's really needed. Again, we continue to enhance and build our surgical portfolio to better diagnose, better treat, have a shorter recovery, and always minimize the surgical site infection. We have introduced in 2020 the first surgical robo from Intuitive Da Vinci. Amazing, because what it does is it relaxes the physician, it gives him a better look at the surgical site. The physician cannot rotate his hands 360 degrees, but the robo can. The robo is capable of knowing that this is a tendon or a muscle or a tissue, and it basically gives you information back of the resistance or the force applied.
So many amazing technology. I mean, I'm sure, Rachel, you have
There's
way more questions than we do.
There's so many amazing technologies on offer. And you know, when you were describing all of this, one thing actually came to mind, and it's nothing to do with the American hospital itself. I just wanted to ask you, as an expert in the field, physician burnout does come to mind, you know, and mental health is a topic that's being explored, you know, at various events, including the World Government Summit. And one of the things that does come up a lot globally is physician burnout, and you know, the overwhelming amount of data that they have to work with at the moment, etc. So I'm just curious to know from your side, you know, looking at Dubai, for example, mid-2024, they introduced the Dubai Mental Wealth Strategy, where they want to integrate mental health strategies into every type of framework, from the workplace to daily living, right? So what's being done, just globally, in your opinion, what should be done to improve physicians' well-being? Because they're dealing with a lot more compared to maybe 10 years ago.
Absolutely, and the pressure is enormous on them. And what is done for physicians, of course, is one is you give them the right tools and the comfortable tools with precision. And I mentioned that you can sit at the Da Vinci station in Dubai and perform a surgery in Iraq remotely, and you're literally sitting, look at a display. You can magnify and zoom in and get a better look at the surgical site. Plus, with physicians, we are giving them confidence and assurance of accuracy and predicted outcome. When I talked about linked deformities, when somebody comes in and he has an internal wear on his knees and he wants an implant, a metal implant, you need to be sure that you're not only going to give him an implant, you are going to correct the deformities and his limbs will be perfect. Add to that is, of course, in our hospital and each clinic, we have psychiatric help, and it's with full enclosure. There's full confidentiality. So if a physician at any given point feels the pressure and close to the burnout, he goes and talks to the specialist there, and that's how he gets a resolution.
I think that listening to the two of you today, I definitely feel more confident, you know, to let AI assist, I guess, our medical professionals on a surgical table. Now, Amer, we had a pandemic about 5 years ago. You guys remember that?
I was there.
Yeah. And I'm sure you can agree with me when I say that it did sort of reshape the global health priorities, so to speak. What, in your view, are some of the urgent transformations we need to make in order to prepare for something of this scale in future? What can make us more resilient?
Amazing. To answer that, there are a couple of components here, and I will identify these components. One is it took us by surprise. So to eliminate the surprise effect, and we felt that we had to fight back this pandemic. What we learned from that is AI would help us in prevention. There is a big science now, it's called genomics. And what it does is it traces the DNA and it deeply analyzes our DNA and RNA. There is a science called the polymerase chain reaction. To be a layman, it's PCR, or the analysis of the DNA. Once we know the nature of influenza, is it influenza, influenza A, is it COVID, what type, what strain, then we can better prevent ourselves. With COVID, we came up with AI components and softwares, and they assisted us in during COVID and post-COVID. For example, lung fibrosis that was done or caused by COVID, that was carefully analyzed and suggested by AI, scans the lungs and tells you, okay, there's a problem here you need to look at. With the pandemic, we were equipped with a lot of tools to basically allow us and give us the power to better plan the next pandemic. One of them is telehealth. Now we are more committed to telehealth, and we basically use telehealth in our clinics. Add to telehealth, we explored about a month ago the use of a robo with cameras and solo motion. It with the collision protection, it walks to the patient with COVID or with MERS or with any contagious disease. You can basically tell the patient, would you mind putting the SpO2 sensor on your finger? Can you put the BP cuff on your arm? Can you? And then the patient complies. You are communicating with him on the screen and getting all the vitals without physically being with him in the room.
Fascinating, and I'll make sure to stock up on my masks as well while I'm at it. Amer, thank you so much. I mean, you literally blew our minds away. We learned so many new things today which we otherwise wouldn't know. Thank you so much for your time today.
Thank you. Appreciate it.
Amy, I believe you have our DXB in 60.
Yes, I do indeed. Rachel, we're going to put you in the hot seat right now.
No.
Oh, no. Oh, yes. We want to get to know you a little bit better. So we're going to do 1 minute on the clock, 60 seconds, and I'm going to ask some quick fire questions.
Okay.
Are you ready?
I'm not sure, but let's do it.
It's all about you. We want to know your answers, so it's nothing too difficult. Okay, so 60 seconds on the clock. Let's go. What was your first ever job?
Oh, my first ever job, bakery.
Your motto in life and in work?
My motto in life is if you don't do it, somebody else will. Always try something at least once.
Definitely. Your favorite quote?
My favorite quotes? Oh God, no, mind going blank right now. Favorite quote, I can't give you one right now. Probably something from a Metallica song or something.
Best way to unwind after a successful day?
Best way to unwind? Well, asking a journalist that is very tricky because we unwind by hitting more deadlines after that full day of events. Yeah.
Your go-to restaurant in Dubai?
Oh, go-to restaurant. I love the old school. So I love a bit of, Maria Bonita, Ravi's, the classics.
Okay, a superpower you wish you had?
Invisibility.
Don't we all? And why Dubai? Last question.
Why Dubai? Well, I mean, Dubai is phenomenal. And the way, look, I'll bring it back to the pandemic since we're talking about healthcare. But we showed how ready we were, and we really did set an example for the world, and that really does tell you everything about Dubai. And even for the next pandemic, whatever, I'm sure AI is going to predict that one, but we're prepared. And I just think it's the opportunity, it's the community, it's the different walks of life, different backgrounds, different nationalities.
Well,
there you go.
Rachel,
Yeah.
thank you for that, and thank you so much for your help today as our guest co-host on DXB today.
No pleasure.
And Amer, it's been an honor having you as well,
Thank
son.
you.
We hope to see
Honor's
you
all
again
mine.
soon.
Thank you. Thank you.
But for right now, don't you go anywhere because we have music on the way. Juna Brown is going to be playing right here on this show. Don't go anywhere.
I'm a big fan of Ray Charles, and I'm a big fan of old stuff, so that's the one that I chose, and it's kind of catchy. I was like about 4 years old when I was at the top of the table, and the visitors, my uncles, my aunts are just around me, and I was singing this song by 4 non-blondes, what's up? 25 years in my life and still something like that. I wasn't expecting myself to be, you know, doing this for a living, but now I am doing this for a living and I'm loving it. And each factor is just awesome. It's really what I wanted to do in my life.